If you're in your 40s, feeling anxious or depressed, or just completely not like yourself, and your doctors keep running labs or telling you that everything's normal, I need you to hear this. Nobody might have asked you or talked to you about perimenopause, and maybe they should have, because what's happening hormonally in your body right now can completely change the way that your brain functions. And most women have no idea, and sometimes doctors aren't connecting the dots, and women might be suffering because of the gap. Today, I'm filling it in. Hi, I'm Dr. Dona, youth and adult psychiatrist, an obesity certified physician, here to discuss all things mental health and wellness related. And today's topic is one that I am deeply passionate about because I'm a perinatal psychiatrist, which means I specialize in how hormonal transitions can affect mental health, pregnancy, postpartum, and yes, perimenopause. These are windows of vulnerability that the medical system is still catching up to, and women truly deserve better. So, what is perimenopause and why does it affect the brain? Let's start with the basics. Perimenopause is the transition period before menopause, when your ovaries start producing less estrogen and progesterone. It typically begins in your early to mid 40s, though it can start earlier, and it can last anywhere from a few years to a decade. Most women know about the physical symptoms, irregular periods, hot flashes, night sweats, but very few are warned about the psychiatric ones. Here's why this happens. Estrogen is not just a reproductive hormone, it is deeply involved in brain function. It regulates serotonin. It modulates dopamine. It has anti-inflammatory effects in the brain. It supports sleep architecture. It affects the stress response system. So when estrogen levels start fluctuating and eventually declining, all of those brain functions are affected. And it's not in your head. It is literally in your brain chemistry. So what are some of the mental health symptoms nobody warned you about? What does this actually look like? Let me describe the patients I see in my clinic and tell me if any of this sounds familiar. Anxiety that came out of nowhere. You were never an anxious person, but now you're waking up at 3 a.m. with your heart racing, your mind spiraling, catastrophizing about the things that never used to bother you. Depression that feels different from sadness, more like a fog, flatness, emotional numbness, loss of motivation for things that used to enjoy. A sense that something is fundamentally wrong, but you can't quite put your finger on it. Rage or irritability that feels disproportionate. Snapping at your family and then feeling terrible about it. Emotional reactivity that feels out of character. Brain fog. Word finding difficulties. Walking into a room and forgetting why. Fear that something is seriously wrong with your mind. And most of these women have been told, your labs are normal, you're probably just stressed, maybe try therapy and antidepressants, and those things can help. And I definitely know, I'm a psychiatrist, right? But if nobody is addressing or even talking about the hormonal piece, we are only treating part of the picture. What the research tells us and why it's alarming. Now let me give you some numbers because this research just published in this past week and it stopped me in my tracks. A landmark study using data from over 128,000 women found that during the 4 years surrounding the final menstrual period, the risk of developing a first ever psychiatric disorder increased significantly. We're talking a 30% increase in the risk of a first episode of major depression. And this one really gets me, 112% increase in the risk of a first manic episode, more than doubled. These are women who never had a psychiatric diagnosis in their lives. And in perimenopause, they developed one for the first time. That is not a coincidence. That is hormonal neurobiology. And here's what breaks my heart about this data. A significant number of those women were probably just prescribed antidepressants and anti-anxiety medications, which can definitely help, but were probably never evaluated for the hormonal transition during these symptoms. They were treated for these things without anyone asking, could this be related to something else, like perimenopause? That gap is why I practice the way I do, and it's why I made this video. What actually helps? A real treatment conversation. So, what do we do? I want to give you a real practical answer here. First, get evaluated properly. If you are in your 40s and experiencing new or worsening anxiety, depression, mood instability, or brain fog, perimenopause needs to be part of the conversation. That means talking to a provider or doctor who will ask you about your cycle, your hormonal history, your sleep, and your symptoms together, not just in isolation. Second, hormone therapy is a legitimate option. I know there has been a lot of fear around hormone therapy historically, and it is not right for everyone. But the evidence has shifted significantly. For women in early perimenopause who don't have contraindications, hormone therapy, particularly estrogen, can be remarkably effective for mood and cognitive symptoms of perimenopause. This is a conversation worth having with a gynecologist or a provider who understands this hormonal piece. Third, psychiatric medication when indicated. If the mood symptoms are significant, SSRIs and SNRIs have good evidence for perimenopausal depression and anxiety. These are not mutually exclusive with hormone therapy. Many women can benefit from both. Fourth, sleep. This is non-negotiable. Perimenopausal sleep disruption, from night sweats to hormonal changes in sleep architecture, feeds back into mood instability, brain fog, and anxiety in a massive way. Treating sleep is treating the mental health. We have to do both. And fifth, the metabolic piece. Perimenopause is also a time of metabolic shift. Estrogen decline changes how the body stores fat, regulates insulin, and manages inflammation. All of these things affect brain function. I see patients who are struggling with weight changes, blood sugar instability, and mood simultaneously, and they're all part of the same hormonal story. I want to close with this. If you've been struggling and you've been told you're fine, you are not imagining it. The transition your body is going through is real. The brain changes are real, and you deserve someone who understands that hormones and mental health are not separate conversations. You don't have to white knuckle your way through this for a decade. There is help, and it starts with someone finally asking the right questions. If this video resonated with you, please share it, because I guarantee you know someone in their 40s who needs to hear this. Subscribe for more on hormones, mental health, metabolic psychiatry, and everything in between. I have a lot more coming. And if you're in Florida, New York, Pennsylvania, North Carolina, or Washington, D.C. and are looking for a psychiatrist who brings all of this together, the hormones, the mood, the metabolism, the whole picture, we're accepting new patients at Dona Wellness Clinic, my clinic. Link is in the bio. We would love to take care of you. I'll see you in the next one.